who are the people who are at risk of heart disease? Does it happen to everyone? Are certain people prone to it? Diabetics, they stand the highest risk of heart problems. People with high cholesterol levels, people with low good cholesterol levels in the body, smokers, people with high blood pressure. We are looking at new risk factors. One is called insulin resistance. We'll talk more about it as the talk advances. Next slide, please. If you have a family history of heart disease, it's likely that the next generation is going to have a higher risk of this disease. There's a chemical called homocysteine in the blood. If your homocysteine levels are high, you're likely to have heart problems. Homocysteine levels go up whenever there is a deficiency of certain vitamins in the diet. There are certain genetic factors which also predispose to this problem. Next slide, please. Next one. Some of these risk factors are modifiable. They are within our control and we can do something about it. Some are not modifiable. And if we have risk factors which are not modifiable and we are faced with a situation, then we should realize that we should work more aggressively to try and control the ones which we can control. Age, gender, hereditary predisposition, race, history of a heart attack, these are some things we can't do anything about. But when we know that we are at risk, then we can definitely address the modifiable risk factors. Next slide, please. Amongst all the risk factors for heart disease, you can see in this chart, it's diabetes which really carries the highest risk. Diabetics have a 4 times higher risk of having a heart attack than those who are not diabetic. Similarly, high cholesterol, high blood pressure, sedentary lifestyle, sitting in the office, you come out of the house, get into your car, drive to the office, sit there, work for 8 to 10 hours, get into a car and come back home and watch television, eat at night and go to sleep. You're the most likely individual to suffer a heart problem in future. Obesity, insulin resistance, and there are certain chemicals in the blood called lipoprotein little a, homocysteine, which we are now realizing are important markers of a future heart problem. Next slide. Diabetes, as I said, is the worst enemy. And you can look at the data. Huge numbers of Indians are going to be suffering from diabetes. Next slide, please. Who is likely to be diabetic? If there is a family history, if you have unusual stress levels, some infections damage the pancreas leading to diabetes, abnormal diets, obesity. It is important that you detect diabetes early because very often you may not know about it for many years until it has damaged organs in the body. Next slide. There are basically two major groups of diabetics. One are the children who develop it more because of an infection or some damage to the pancreas. The adult diabetics are the ones who face a very dangerous problem, and they are the ones who have a lot of insulin in the system which is actually not working. Insulin resistance is seen in this group. Adult diabetics can very often present with multiple organ involvement even before they realize that they are diabetic. So the first time you detect a high blood sugar may already be late in diabetics. Next slide. Blood sugar alone is not enough. You need to look at target organs, protect these organs, besides controlling the blood sugar. And the main organs that you need to keep an eye on are the brain, the eyes, the heart, blood vessels, and the kidney. Besides this, every other organ in the body can get involved in some way or the other with diabetics. Blood sugar needs to be checked frequently, at least once a month, and once control is achieved, you may be a little bit more relaxed in checking it. Next slide. Kidney is an important target for diabetes. A very easy way to detect early kidney involvement in diabetics is to check for protein loss from the kidney. It's something called microalbuminuria. very tiny microscopic levels of albumin or protein being lost from the kidney can herald an oncoming kidney disease. So presence of protein in the urine predicts and predates heart disease. That means if you have albumin in the urine, you're likely in future to have other signs of heart involvement. Intensive control of blood pressure luckily reverses protein loss and reduces the risk of heart disease in these patients.